Hello, friends and family. It's yours truly, Dr. Valerie Mukanga with Healing Means Dental, the place where we help our patients maintain and or regain their oral health. So today I want to talk to you about this fun subject, which is what should I do after I've been numbed? You have people who come in for dental procedures and we have to numb them for the procedure. So after they leave, when they're ready to leave, they're actually numb. So what should they do? What should they do? Should they go about their business as usual, or is there some precaution that need to be taken into account? Okay, so for sure, there are some precaution that needs to be taken, so that you don't end up having some issues. And we're going to talk about some of them, right? So, first of all, when you numb, you're not gonna feel the area. And some people, yes, they're gonna feel like, their face is swollen, but it's not actually swollen. Your face is not swollen, it's just a feeling. You just feel like your cheek is big, or that's just the effect that it actually gives. And I'm talking from experience because I have been numb before. It feels like your face is swollen. It feels like you have a, cheekbone face, but no, you're not actually swollen. And with some of the people, we actually show them a mirror because they're absolutely convinced that their face is swollen and it's not. So you are not swollen, okay? But it does feel like it. But what I was saying is that you do not feel anything, right? That area feels kind of a little bit warm, and you don't really know how you're biting, what you're chewing on. So the danger of you going home and being hungry and going to eat right away is that you're not going to know how you are chewing. You're not going to know what you're chewing on. So you can end up chewing on your cheeks, you can end up chewing on your lips, you can biting your lips, you can end up chewing your tongue, right? And you're not going to feel anything. The only way you're going to know is that you actually have bleeding, and sometimes you can't even tell, right? So actually, I remember one time, it was in dental school, and I had my old bridge removed. I was numbed for it. And so when I went before going to study, it was in school. I actually went to a restaurant, and I actually went with a friend. And so I ate. I didn't give it the right time, and I ate. And when I wiped my mouth, it was blood. And I was like, "Ooh, that's what they talk about, right?" But I did not listen to the advice of the student doctor that actually treated me. So, yes, you definitely want to be very careful of not eating food that you actually have to chew on. So, the good thing to do would be, even before you go to your appointment, don't like feast on a, huge meal, but try to put something in your stomach. That way, you can actually wait, all the time that it's going to take for the numbing to run off. In general, on average, it takes about 2 hours after you've been numb for that sensation to go away, for you to stop being feeling numb, for the anesthesia to actually run its course. But then again, it's going to vary on people. Some people will metabolize the anesthesia very fast, and some people will actually metabolize it quite slow. So you kind of have to gauge, right? You have to gauge of how you are actually feeling. Oftentimes when the numbing runs off, you're going to start feeling like some tingling around the area. And so you would know that, you are almost no longer numb. But you want to avoid eating right away because, as I said, you can end up chewing on yourself, not knowing, that you're actually biting and on yourself. And it can be, it can actually cause you some problem if you have done it. In my case, I didn't really have, some major problem, but I tell you, with some people, when they actually have, chewed on their cheek, while it's healing, the area looks like it's a huge problem, right? Because it's gonna look kind of like a cheese-like substance. It looks very, very ugly, and it can also be end up being swollen. In fact, at that point, it really depends on how hard you actually beat down on yourself. And I remember one time, it was a very, very long time ago, there was a child that I actually had treated and the child actually bit themselves, I would know because they came back to the office. But prior to doing so, it was actually, I think it was on a Friday because they went in the weekend when that happened. The father was so upset that he took the child to an emergency room. And as I said, in the emergency room, oftentimes they won't have a dentist, and the doctor may or may not be familiar with what like a bite looks like in the mouth, like inside a cheek or whatever. They may not really recognize that the child simply bit on themselves. So guess what they told? And I don't even know what. That's what they said. They said that the doctor told them the doctor probably used a dirty needle. And I'm like, a dirty needle? Why? We have so many of them. Like, why would I need to revert to using a dirty needle? No, we make sure that every children that we treat, every patient that we treat, we use fresh instrument because you don't want to cross contaminate people. And plus, that's my license on the line. So no, I would not do such a thing. Never, ever. But what I ended up doing to comfort the parent is I pulled up some images on the internet. Thank God for Google, and I showed them what bites can end up looking like if somebody bit themselves not no unknowingly. What it can end up looking like, and that was exactly how the child presented. So thank God for smartphones and all of that. But yeah, you definitely want to avoid that, right? So if you're absolutely hungry, if your child is absolutely hungry, try to eat something that you don't have to chew on. Perhaps you can go and get a smoothie that you can drink, something that you don't really have to chew on. So that's one thing that you want to make sure that you do when you're feeling numb or after you're being numb. You want to let it, go through its own course, like the anesthesia. That way you don't cause you additional problem. That's essentially like the advice that I wanted to give you to just be careful, right? So that you don't end up causing you some problems. So today episode is really short and sweet. Just be careful when you're numb because you can end up causing a problem. The last thing I want to talk about, in fact, that I just recall is that, with some people, when you numb them, right? And that's just like what they can feel or what you can feel like, okay? Or what it can look like also is that with some people when you numb them, especially when you numb them on upper premolars, which are just some chewing teeth kind of like before your molars, you can end up feeling numb around your eye area, right? And so if you feel like you have been numb and you feel like your eye, you can't really see very well, or your eye is closing up a little bit on you, or your eye feels a little numb, in some people it's normal. So don't be alarmed. As soon as the anesthesia runs off, things go back in order. So don't be alarmed, okay? And then another thing that can happen is that your lip can seem like it has drooped down. And that's normal. So usually you're not going to look like you're swollen, but sometimes your lip can end up looking like it's drooping a little bit. So when you smile, it can look like you might have had a stroke. It's not a stroke. It's just the fact that you are anesthetized. And what usually happens is that right after the numbing goes off, it's gonna revert back, and you're just gonna, regain your pretty smile. So yeah, so just be careful. Those are some things that you want to avoid. How you can recognize first that you are numb, like some things that look kind of funny when you have been numb, but the thing that you really want to do is avoid eating right away after you have been numb. So that being said, if you are in need of a great dentist, somebody that can take care of you, an office that can, care about you, like you really matter because you really matter, give us a try. We are Healing Wings Dental, located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. Arlington is located in the big metroplex of Dallas-Fort Worth. And so you can also give us a call at 972-213-0202. or you can go to our website to actually request an appointment, and somebody will get back in touch with you so as to make the appointment happen. Okay. And you don't have to wait ages to be seen. We can see you in a timely manner. Very rare. Sometimes we can see you the same day, but oftentimes we can see you the next day or within the week or the next week. Okay. So that being said, I wish you a very, very great day. Take heed to your oral health. It's very important. It can help you in so many ways in life. Okay. Improve the quality of your life. So you take care. Okay. And be blessed. Bye bye.